start. Okay. Hi, everyone. Can you hear me?
Yes,
Yes.
she's saying yes.
Oh.
Yes.
No,
Okay,
she was
that's
muted.
Linda.
She
Okay.
was muted.
Oh, okay, okay. All right, so we have three here, Yuka. We need a fourth person in person to be a quorum. Monique is coming.
She made quorum, but you can call it to attention.
Yeah.
But
So
if there's
as soon as she
anything to
comes,
vote on, you have to
have
have
a
a
fourth
quorum.
person.
But you can definitely call it to attention and start the meeting.
Okay. All righty. Oh. So has everyone signed in? I believe so. And welcome everyone. Sorry for our little lateness in starting. We, as always, waiting to make sure that we do have quorum in case we have to vote on something. And also because we want to make sure that everyone gets our information, that we have the maximum amount, of members so that they can be apprised of what's going on. So my name is Laquita Henry. I'm a co-chair of Health and Environment. We have Cameron Clark here. You want to say hi, Cameron?
Morning, everybody, or good evening, everybody, as I just combobulated iron. I'm gonna be eating for the first probably 15 minutes and I'll lock it.
Okay. And then we have Heather Jason who's here. You want to say just hello, Heather?
Oh, good evening.
When our fourth person comes, we will have a quorum. That's Monique, and she's already indicated that she's running a bit late, but she will be here. And we have two of our committee members scheduled for Zoom. One is already on Zoom, Lena Nepomniachtchi. Oh,
Hi, that was well
like I got
done.
it.
That was great. Hi, everyone.
I'm gonna get better though.
That was
Okay,
well
thank you,
done.
Lena. And then we have other friends and important okay, thank you. Members who are here, Dr. Danielle Milano on the line. I think there's Wendy. Wendy's on the line, Wendy with the trust. Has a group that works with youth, and I'll get the names together. We have so many. I'll get the name of that together, Wendy, shortly. And then, of course, we have Christopher Johnson with the Emma Bowen Center. As a matter of fact, right now, because we do have a little time, the meeting was called to order at 6:42 p.m. And we have Michael here from the Columbia Spectator. And there may be another colleague of his who is here. So with everything going on now in the area of health, from time to time, they will be in our midst. So I wanted to announce them. Adopt the agenda. I think we can adopt the agenda.
I think we can just,
And then,
if we can adopt it.
mhm.
So we have form.
Yeah. Okay, so I'll formally do it, or Cameron formally do it when our fourth person comes. And in terms of the minutes, we'll have both of our minutes. I think we have actually the September minutes were not in this packet, but they were at the executive committee. So again, we could hold off on that until next time, because we didn't have it in this packet. Okay, a couple of things. Our community board the number you currently have because it may be, it may still remain a part of our, you know, communication system. But right now, we're having problems with it. So we have an office number, should you need to to reach us. 646-355-3172, and I'll repeat it. CB9 district office number, one of the numbers, and the one that can be currently used to reach us, 646-355-3172. Okay? So we have on our agenda a couple of things. We always have the New York City Department of Health and Mental Health in our midst, or on the agenda. I'm not sure if, that person is on Zoom. That's our liaison is Pauline Ferranti. Is Pauline on?
No.
Okay, she's not on. There's a lot that's going on still. It relates to policy, Legionnaire's disease, COVID-19, vaccines, measles vaccine, immunizations for children and adults. Much of that was discussed at our last meeting, but maybe what we can do, our co-chair Cameron Clark had participated in a hearing on Legionnaires at City Council. And Cameron, if you're ready, what we can do is have you perhaps talk about what happened at the hearing, and then tie in any other as it relates that you may know that might relate to us outside of Legionnaires, any of the vaccines are totally off guard, but
Yeah, no problem.
Okay.
Everybody hear me okay on Zoom? Looking for one head nod.
Yes, I hear.
I have a feeling
Okay.
that
Yeah, I think they can.
Monica, oh, that's Monica Dula. Hi, Monica. I don't know if she can hear. She
But,
may be walking around, but anyway, go ahead.
but yeah, so basically, September 19th, was the city council hearing on Legionnaire's disease. They were hearing on two separate bills that both had like sort of Legionnaire's disease implications. One was a bill that was essentially going to require building landlords to provide their residents with shower hoses if there was a case of Legionnaires, like in the boilers in a specific building. And then one was essentially creating more stringent standards for reporting for the city overall, the city health department, when it came to cases of Legionnaire's disease. So the second bill, I think, really was something that was addressed and something that we were calling for in the resolution that was passed at the last, I guess, general board meeting for CB9. So it's like something akin to that, with like more frequent testing requirements by the city and more frequent inspections. But I think what was really interesting in the hearing, just to recap it briefly, it was, there was testimony by the city department commissioner, health department commissioner, who was really talking about like their overall response. I think one of the things that they mentioned was like, how this outbreak was, not really, I guess they were trying to argue that it wasn't unprecedented and that the response was actually adequate. Which I think a lot of the folks who were in community that came out to present and to testify, I think were a little bit taken aback by the assertion by the health department that this response was sort of anything approaching adequate. So I think that was surprising. That, there was discussion coming from the city council members about like whether there was the staffing was actually appropriate to, in doing the annual
Place, system that's unstable, so from time to time, it might
Can y'all hear me on this one?
Yes, now I can hear you.
Oh, I'll hear it on my computer. Yeah. Y'all can hear me okay?
Yes.
Yes.
Awesome. All right, cool. We'll see if this works. Yeah, and so we had one question about, the shower hoses, and essentially that goes back to like the presentation that we did a couple weeks ago where we were talking about sort of the difference between like a community spread outbreak and like a local building outbreak. So when there's like a community spread outbreak, that's when it's coming from the cooling towers in the building and it's spraying sort of Legionella bacteria into the community. But, the more frequent but less severe, could you get that from me, Phil? Yeah, the more frequent but less severe cases, or less widespread cases are usually from sort of hot water sources inside a building. So like boilers that are going untreated, and Legionella coming out of shower heads. And so what the health department actually found, or I think not the health department, what independent researchers actually found is that when there is a case of Legionella that is localized to one building, one of the ways that you can avoid or limit the spread of that outbreak inside of a building is by giving folks shower hoses that they can attach to their shower heads. That'll sort of like, instead of spraying like in a diffuse spray, will allow people to sort of take, like water hose showers, so which are less likely to like sort of get aerosolized Legionella bacteria that you can inhale. So that was one of the bills that brought up. The health department was, I think. All right. So essentially, it was a bill that would require building owners to provide tenants of their buildings with hoses in the event that there is a Legionella outbreak inside of one of the buildings. The reason for this is that hoses during an outbreak are less likely to spread Legionella because they're less likely to spray water into the air than like a shower head, a traditional shower head. The health department was not a huge fan of that idea, I think probably because of the costs that would involve to landlords. I don't want to speculate, but one of the things that they did bring up, in response to some of the critiques from council members and community members about the severe understaffing, was that they are actively hiring for new positions of like water ecologists and testers for some of these positions that have been vacant for years. Unclear, like, I mean, I think there are a lot of reasons you can speculate about why these positions were empty in the first place and why they have remained empty for this extended period of time while we were going through this outbreak. But I think through a combination of, sort of public attention being paid to this issue, and then I would say probably renewed recruitment and outreach by the health department. They actually have recently hired, I think, about 3 additional water ecologists. I think they had 5 before. I think that brings their total to 8. So it's almost double. It's like, and let me actually double check that number because it might actually be a little bit different. But I can post the article that's talking about the new hires, and I think this is something that I think is at least partially due to some of the community attention that's been on the health department as a result of like this, I would say, pretty botched public health response. So yeah, so I think the department agency now has 30 water ecologists, which is a 25% increase since the start of the outbreak. So I think that's a jump. And I think they still have a few vacancies and they're still actively hiring. So, as always, if there are folks in your communities that you know of that have, some of that specific experience in water science and disease surveillance that might be interested in serving their communities in a way that can help, avoid some of these outbreaks in the future, definitely feel free to forward that information to them. I just posted the article in the chat. But yeah, so I think that's one thing. I think the other thing that was interesting is that I actually I testified at the hearing, and afterwards I connected with some of, and I think there were a few different folks that testified at the hearing. But I connected with some folks who represent and it's a Legionella outbreak task force that, I think I was not aware of until the hearing, but I think it's folks that are predominantly in like CB10 and maybe CB11 that have been working on this and been trying to like expand. Yeah, community members and regular citizens, not nobody like appointed by anybody, but I think sort of folks who had, who were concerned. And I think it would be, what's up?
What are they doing?
And so I think one of the things is I'm trying to find out. And so I thought they mentioned that they felt like they had been sort of like stymied by the community boards in their districts. And so I thought it might be interesting to invite them to come present to us at like one of our next meetings and see if there's any, potential area where we can collaborate. Yeah, so I can, if folks are down, I can reach out to them. They weren't free until like after October 21st, which is why I didn't invite them to this meeting. But yeah, so if folks are down, I can reach out and we can see if we can get them to come and share and exchange with us at one of our upcoming meetings.
One of the key things, I don't know if we had a chance to actually emphasize it, Cameron, I think you did mention it, but I want to stress that the thing that was really a big surprise for me, and I'm sure a number of other people, is that most of the Legionella found buildings were buildings run by or owned by, managed by New York City. And the fact that they were not following through, ostensibly anyway, following through on their obligation, getting the inspection reports back and having an opportunity to even look at them. So we had to alter our resolution, which was put together and mailed to city officials. I want you guys to know that because our committee has been really on point. And Cameron came up with that sentence. I don't know if you have it in your head right now, Cameron, but we were asking for even more, 1 or 2 more reports because it does involve the city, so it means the obligation is even greater, that they don't fall back either. And, I'm wording it this way, is not to quote unquote blame or attack, but we do have to be firm to show these agencies community, and that we wanna make sure that we're not getting the short end of the stick every time something comes up that's dreadful, especially with Legionella often showing up and I think Cameron made this, recognition at our general board, showing up primarily the last several big times in Harlem and the Bronx in Black and brown communities. Something's wrong with that. So we want to be on top of it. So we're going to be very strong. Doesn't mean that it's to be taken personally in terms of not liking someone, because it's not about that at all. It's about, we really need people to be on top of their jobs, or whoever is on top of that particular instance to stay on top of it. Because we should not be in a position to be, you know, catching heck in lieu of another word, you know, because of this. Because these are, especially with Legionnaires, as I understand it, it is preventable.
Absolutely, 100% preventable.
And so we really, you know, we can't be afraid to say, no, we need more of you from the city, in our community, or all of the communities, but we're specifically talking about ours. Let's get these reports in. If they're not in on time, what's preventing that? And what are the risks?
Yeah, go for it.
So Chair's comment and a question. I mean, the comment, given what's happening now, I won't rehash everything, but with cuts occurring and going into the flu and whatever season you want to call it, in terms of respiratory conditions, it's so important that we just stay on top of what's happening so that things don't get exacerbated in our community as they already are. I guess is my comment. My question, Cameron, and I'm sorry I haven't been on top of this as much, even though I'm very concerned. Do you know how many people came to testify at the hearing? And I'm assuming the cutoff date has come and gone in terms of any further testimonies that would be able to be submitted?
Yeah, so in terms of the number of folks, at least in person, I think we got about a dozen or so folks that testified. So a few folks, you know, that were like, you know, affiliated with us, like a couple of folks that were from like the Harlem Legionnaires Task Force. And then there were a couple folks on Zoom afterwards. But yeah, so I think, and I didn't stay for the Zoom testimony, so I don't know how many folks, but you know, I assume that was at least, you know, it would easily be into a dozen plus folks. that came to
And the testimony cutoff?
Yeah,
has
so
occurred and-
that was September 23rd, I think was the last date to submit like written
And
testimony.
when will it be published or public where we can read it and maybe put it on our website?
I'm not aware. Oh, and I see Lena submitted written testimony. So we have a few folks that definitely submitted written testimony if they didn't even show up.
Oh,
Yeah.
great, Lena.
But yeah.
Okay, I was just gonna ask Lena if there's something you wanna say about your testimony. Thank you so much.
Well, it was very easy because I used a lot of the stuff that Cameron had put together through the other thing. I can't remember what it's called. Cameron, what was that PowerPoint that you guys had?
That was the presentation with We Act and Uptown Tenants.
Yes, right, We Act. So it was super useful because I just pulled a lot of data from there. So it was very easy to do, and I would love to, you know, if we need to do that in the future, like have a bunch of people submit testimony, we could produce like a document, right? And then just have people submit it if that's ever helpful to do. Because sometimes just numbers really matter, right?
Mhm.
Laquita, it's Monica.
Yes, Monica. Hi, Monica.
Have we heard from DCAS? Those buildings that where it was found are buildings owned by the city. I think some were operated by City College. Have they spoken? Because DCAS is in charge of maintaining all of the city's buildings.
And maybe that's why, that might be why our representative liaison is not here, because maybe she hasn't. But that was one one of our requests to get to have follow-up on all of this. And so the answer is no on my part. Was there anyone there, I'm just gonna ask the question, Cameron, was anyone there from, the inspection, companies? So that's a very specialized group. I'm not sure how many there are in the city, maybe 3 or 4 of them.
Not that I'm aware of.
And of course, now that all these people are being sued, they probably would not show up, but,
Yeah, I think the only folks that I was aware of from who like represent the city's interests, and I'm still connected on this one, so we're good. But the only folks who represented the city's interests that I was aware of that are connected were the city health department.
that's why Cameron's on this.
Yeah, we need to hear from DCAS. They're in charge of maintaining all the city's buildings. And since the outbreaks were, it seems like exclusively New York City buildings, we need to hear from them. I mean, the shower thing is great, but the reality is this outbreak was it seems like commercial office building space, not residential buildings.
Right. And that was why I made the statement that I did. I'm not sure if you were on at that time. You were on.
I
But
didn't hear you, Laquita.
I mentioned that, obviously there's some aspect of blame that has to go around, but the idea is that people shouldn't, those representatives should not take it, as if we're necessarily scolding them, but we are holding firm that somebody has to take responsibility and see to it that these inspections are done and done in a timely way and report it back to the community. We have a right to know and, and to hear from them because it's totally avoidable. And something is wrong because it seems to be, I guess symptomatic, because I guess that would be the word, because it's always something that's happening in communities of color. The last 3, I think, big ones Cameron mentioned over the last number of years have been one in the Bronx, and here in Manhattan.
Yeah, 7 out of the last
Black
8.
and brown, how many?
7 out of the last 8 over the past 10 years.
Yeah. Something's wrong with that. Something's wrong with the system.
And that was one of the interesting things that came out during the hearing is that one of the questions that we had, and one of the things that I wrote in my testimony was that, among the many things that the city needs to do is like prioritize, really disenfranchised, marginalized, impacted communities. And during the health department's testimony, they actually did mention that they do prioritize like our communities when it comes to inspections. So I think it leads me to believe that, the issue is not just that they aren't prioritizing, but just that they literally are so understaffed. 30 inspectors for the entire city to inspect, thousands of buildings is unrealistic to be able to catch anything.
Give special attention here because.
And they're saying even with the special attention, so they already are paying special attention. They still, so it's
not.
And I think it also leads me to believe that there's like an underlying sort of, and this is something that we all know about, just like the underlying maintenance defects and, deferred maintenance and repairs that sort of define a lot of Upper Manhattan and the Bronx buildings and the built infrastructure in these neighborhoods. But I think the health department alone is not equipped to the scale of this problem. So I think
they gotta find a way to equip, bring in some people from other states. I don't know, but it's not acceptable. We can't just say,
no, definitely
oh,
not.
well, that's gonna happen. We got 7 people dead. Oh, well, we're gonna, kill a few people along the way.
Yeah.
That can't be
Also,
done.
I guess we could pause for a second since I think we have quorum, so we could probably call to order, or
Well, we could call the order, but now we can vote.
we can vote, but we can adopt the
We can
agenda.
Thank you very much.
Does anyone want to move?
So we have, to adopt the agenda, I think that's minutes, I can explain that again, but Can we get a motion to adopt the agenda?
I need to adopt the agenda.
Who will second?
I was trying to get out.
Second,
Who was that?
Couldn't find it.
Monica.
Recording in progress.
All right, awesome.
Committee member Liz, you seconded the agenda? Or Heather?
Monica? Sorry. Okay, I think we're good. I think there was an echo for a second.
Okay. DCAST, is that D, like the letter hyphen KAST?
No, DCAS, I think.
D, oh, okay.
CAS.
Okay. I don't know why.
I have a question.
Mhm.
Since we're still talking about the Legionnaires, issue, what is the movement around some visual for those who?
We had thank you, Monique. We, in this committee, came up with the suggestion of a vigil to, just give homage to, those who unnecessarily lost their lives. And I had said to Victor, I thought October would be a great month. And at the time, he wanted to make sure he was in touch with CB10. And I figured, also probably CB11, just keep it, and even 12 in the area, all the community boards together. But that we should take leadership on this, because if we're waiting on them, CB10 already has a Legionnaires task force. But that may be independent from the board. I think that's a general group of members of the CB10 community. So he had indicated that he was in touch with them. And I also mentioned, since, what's Al Sharpton's group? NAN, National Action Network, had come up with a lawsuit, they would be instrumental in helping us get those families, well, approval if they wanted their people, their deceased recognized or names mentioned, which they might. So to add them into our visual aspiration. So that's moving a little more slowly than I thought, but also we have our public hearing that's on the 8th, so I think we can push forward probably after that. But that's one of the key things that came out of our group, is wanting to have a vigil. And that vigil could be near City College, it could be on 125th Street, or it could be right in front of the city office building. But something so that these people are not just a number, because the way things are going now, that's the way it sounds, like they are just a number. And whenever I hear 9 people died, it's just like, it's really just casual, too matter of fact. But especially when it concerns incidents or accidents that are totally preventable, I think we need to do something. And this is the last 7 out of 8. We have to make a statement in some way that our community is not expendable like that.
Yeah, so I
Or
guess
disposable.
maybe we can follow up with Victor after the hearing.
Yeah, after the hearing, for sure. He said that there was, this text indicated that, this week there's supposed to be, he was gonna try to, or the community board 10 person felt they would be ready, to have time for a call, a group call. All right.
All right, that's all I got on Legionnaires, if no other questions.
And so it's good timing, because our colleague, community board member and friend is here. We can sort of move past, district needs, because Barry's not here, so we can do it afterwards. But since this public hearing has a lot to do with the Health and Environment Committee as well, it's being led by Housing, Land Use, and Zoning. But, and they have done a fantastic job, co-chaired by David Ratner and Maxine Sarcy. And they had a general meeting last week on
review really what's at stake, what's at hand. And we really need this committee to be present at that public hearing. And so David is here, David Vassar.
Right.
I'm looking down here, Vassar, I did that before. Okay, David Ratner, who is one of the co-chairs, is here to give us that brief overview. We'll be reminded and we'll know there are many of us who on this committee who are new, but we can rehash some of the issues. And we basically won this situation to bring about a ULURP. This was through Barry Weinberg, Insigne, and Elizabeth Wakus, who were co-chairs back in the last couple of years, and Health and Environment, our committee at that time, Dr. Torres, Edwin, and I were co-chairs. So, and it's a lot. It was a major, many people in the community rallied. This has been a major ordeal, and through the research that Barry in particular did, we basically got our city council and Manhattan Borough president to believe in us and push for 1727 being taken off this, others named for when they were not among the list of buildings that could be taken over by the city without a ULURP hearing from the community first. So David Ratner, take it away. Thank you so much, David, for coming.
Happy to be here. Thanks for inviting me.
You may have to talk up a little bit because our sound, you may want to talk
Yeah,
over
it's-
there. Or there if you want, yeah. we
Well,
can
that's
see if you
okay.
want.
So is that Liz Wakus is on? Or
Is that Liz on? Oh, is Liz on?
Liz Wakus.
Oh,
Who-
I'm just trying to listen.
Oh, that's
Oh,
Liz
okay.
Eastman.
Okay, sorry.
That's
Sorry,
okay,
sorry,
that's
sorry.
okay. Yeah, the other, our Liz here with Health and
Okay,
Environment.
okay. So, would you like me to give you the
You
background?
could,
of
yeah,
this?
just,
Okay.
just very brief.
Well, I'll try and be brief.
Because most of, maybe there are about 3 people who may not know some of that,
Okay.
some may be.
If I'm just repeating what everybody knows, please stop me.
Well, we have a few people on.
So anyway, this is a redevelopment project by the city of New York. HBT is the lead applicant on this unit. The history of this project is not entirely clear, but it goes back to at least 2019, probably before that. And
You can keep going.
yeah, so the site is 1727 Amsterdam Avenue, which is on the corner of 145th Street. There was and is a building that was built in the early 1970s as
So this is the
essentially a
battery.
dedicated healthcare facility. It had various tenants. The most recent iteration is the MO.
I can barely hear you guys. I can barely hear.
Your voice has, and maybe we can.
This is the audio.
Oh, okay.
Go for it.
So the most recent iteration of the occupants of this building was Emma Bowen, which is a mental health facility,
Heritage Health and
a
Housing.
place called Heritage Health and Housing, and I think there was also a third, which was
Yeah, Dr.
Jackson
the
Ophthalmology. Or,
Center of Ophthalmology.
right. So the city, well, the building has not been well maintained. And the city saw this as a opportunity to develop what they call an underutilized site, meaning that there was, under the zoning resolution and various bonuses that have come along over the years, an opportunity to build a much bigger structure and to use it for affordable housing, supportive housing for seniors, and supportive housing for formerly homeless individuals. So they came up with this. They came up with this plan. They actually hired a developer in 2019 called the Bowery Residence Committee, and they put together a plan which, for reasons that are not clear to me and probably aren't clear to anyone, they decided they did not have to go through the Uniform Land Use Review process. In 2020, in August 2022, a member of the CB9 community got in touch and said they're taking soil samples at this site. What, you know, can you find out what's going on? At that point, it was really Barry Weinberg, Liz Wakekus, and Sidney Mortensen who were running the Housing Land Use and Zoning Committee. They made some inquiries, and basically they were told, well, you guys weren't supposed to know about this. That created quite a brouhaha. I understand there were at least a couple of committees. This committee, obviously Housing, Land Use, and Zoning, maybe Landmarks, also Heather, I don't know, got together and put together a resolution.
And there were two community groups, homeowners who got involved.
There's a lot of stuff I don't know about the
Oh, it
history of
was-
this, but
It
anyway,
was major.
this is my somewhat condensed version
Yeah, we'll
based
just
on
add
what
it
I've
there.
been able to
Mhm.
figure out at this point. They put together a resolution, and I think perhaps the focal point of it was that it was outrageous that the city was trying to avoid community input by trying to get around the ULURP process. There were also some very pointed concerns raised about this project as well. And they were included, well, let me say, that after the community board found out in August of 2022, then HPD and Health and Hospitals, which was at that time spearheading the initiative, sat down, and there was some very frank exchange of views at that point. It resulted in, as I say, in this resolution that came out in June of 2023. And to summarize what I believe were the objections at that time, this project is intended to have 120 supportive housing units for formerly homeless people. Then I think it's 23 senior, also affordable housing units. Those units, I believe, are capped at 30% of income because they're also Section 8 vouchers attached to those units, I believe. Then there's the rest of it, which is, I think, 57 units, will be between 40 and 60% of AMI affordable housing. The community board resolution, so I'm not sure if it's in the resolution or this is something that Barry brought up subsequently. There was a concern about the amount of supportive housing in this one project. It's an area that has 2 schools within, I think, a 2-block radius. There's apparently a lot of activity on the street. So there's a lot of concern about safety issues because of that. And Okay, and that was one thing. The other thing was the concern about losing community health facilities. The current building has something like 59,000 square feet of community health facilities. I'm not entirely sure how it's divided up between Heritage Health, Emma Bowen, and Jackson. But under the city's current plan, they have relocated Emma Bowen to a place somewhere on 135th Street. They claim to have worked with Emma Bowen to design this space in the new building, but it's going to be a reduction from 59,000 square feet
When
to
they
20,
return.
yeah, when they return, to 21,000. Heritage Health, there was no provision for Heritage Health. And in fact, Heritage Health is challenging, they're in the middle of an eviction proceeding where they're challenging the right of the city to evict them. And Jackson is not going to return. I don't know where they went.
They will be part of the space that Heritage Health already owns, Heritage Health.
Oh, okay, but that's not
SCC.
that's not 1727.
It's not 1727.
Yeah. Okay.
1740, I'm sorry, 1649 Amsterdam is where they will go.
Anyway, it is the loss of community
Exactly.
health facilities in that exact spot, which I think is of great concern. I think one of the other issues is what the rent is going to be for Emma Bowen when they return, and whether there is going to be an increase in rent, which we've heard rumors about. It has not been confirmed. Whether that will affect their long-term viability. There also was raised in the CB9 resolution from June of 2023, the issue of not having, is this a problem?
It's on.
Oh, okay. The issue of not having retail on the street. There's absolutely no retail part of this new plan. I think CB9 suggested that having a grocery store in this space would be a really good idea because this is a bit of a food shopping desert, and also to have eyes on the street, as it were. There are probably a few issues that I'm not. Yes,
But I
sorry,
think
Heather.
another issue was the size of the units.
I'm sorry, the what?
The size of the units are primarily.
Yes, that's right, that's right.
Family oriented.
That's right. All of the supportive housing units, the units designated for formerly homeless people are studio apartments. And then there's a mix, mostly of one family, some two family, and just
And
a
there were a few
handful
for
of three
three.
family.
Some three,
There are some three.
yeah, very low
family.
number.
Right.
Three family or like 1, 2, and 3 family or 1, 2, and 3 bedroom?
I think it's 1, 2, and 3 family units is
What,
mine.
I guess, do you know what
That's not correct. They're studios, 1-bedroom units, 2-bedroom units, and I think there's supposed to be like 2 or 3 3-bedroom units. They're not 2-family anything.
Actually, I can check that because it's right on the BRC's website. Yeah, I'm sorry if I did.
Okay.
Um,
That's a lot of detail there.
Sorry,
Yeah.
it's a lot of
We
detail.
got it.
It is a
And I-
lot.
Yeah,
So-
can I add something? It's only 15% are of the apartments, the studio, whatever's, that only 15% will be allocated to people who live in Community Board 9.
That's other
And
questions.
it's a lottery.
1%?
1.5, that is correct.
I mean, and so that's ridiculous. The importance of this EULR, right, should be that we, the community, have the opportunity to express our approval, what we approve of, and disappointment, objection to those things that do not benefit the community, thereby making some changes in this plan. Otherwise the community will not be properly served nor satisfied. I would think most ULURPs allow for community input so that changes. The crazy thing about this one is that it's not like there's gonna be a bid out to select a developer. We really lose out on that part of it. So this is a limited ULURP, something like that?
Yeah,
A very limited ULURP. So we have to maximize
well,
what we can, unless I wish,
And it's,
You-
sorry,
Generally
I didn't wanna, I don't know if you
Yeah.
were gonna
Yeah,
continue the
oh, he is,
presentation.
he just told us to insert where we
Yeah.
can.
Okay.
Karen, before you go, this
Oh, I
is
was
from
thinking
the
about
site,
ours.
this is from BRC's site. So they say 6 3-bedroom, 25 2-bedroom, and 31 bedroom, and then the rest are studios.
Okay.
Yeah, so I'm sorry.
No, you're good, you're good.
This is well, first of all, to be perfectly honest here, I'm the new kid on the block.
And you're doing fine.
Yeah, whatever, but I don't have the depth of experience to talk about what generally happens in ULURP. But I will tell you my understanding of this particular project. And the reason I went into the whole history of it is that generally there are, the ULURP process, as far as the community board is concerned, there has to be a public hearing, but the community board gets most of its input before the public hearing takes place. There's a sit down, and there are comments about, maybe you should put more 3 bedrooms and whatever. That happened in August, but by that time, it was very clear that the city was not interested in hearing what the community board had to say. They had, for whatever reason, they had determined in their minds this was not a project that needed any community input. They had pretty much gotten all the financing and plans down long before they sat down with the community board. You should also be aware that I mentioned there was a meeting in September of 2022, right after CB9 found out about this project. And the community board, Barry, I guess, and Liz and Signe and whoever else was involved in this, actually put together a counter proposal to solve all of the issues, essentially solve all the issues that I've mentioned. And that counter proposal was for the city to rezone this site. The 1727 is on what's called an R7A zoning lot, which means, and I don't understand everything about what it means, but it can be built up only to a certain level. And the plans that they came up with pretty much come up to 100% of what is allowable. It's going to be, I think, 9 units. There's a setback after maybe 6 stories, and then it goes up to 9 units.
Stories.
I'm sorry?
Stories.
Yeah, I'm sorry, stories. So they said, well, if you upzone this to R8A, then you can build up a little bit higher, and you can put retail on the first floor. You can expand the community space. They were never against, they always wanted to reduce the supportive housing, but they said, you know, you can have more affordable housing and hopefully at lower AMI bands, the area median income bands. And this was in 2022. And so there was, at that point, there was plenty of time for the city to actually incorporate these ideas. But by the time we got to 2025, when they finally put in the ULURP application, their position was, well, we can't, that would take too much time, because to rezone, we'd have to do a whole other ULURP, and it would set us back, you know, a year or 2 years, which is true. But if they'd done this in 2022, when a very sensible pitch was made by our community board, it would not have been an issue. I mean, perhaps there would have been other issues, but the main one, which is they can't afford the time, would not be on the table at the moment. So that. I think that exhausts what I'm able to tell you at this point. Well, in terms of this committee, what I was hoping was that you could look into this question of, you know, what the reduction in space is going to mean if this project gets built. Maybe get in touch with Emma Bowen, find out if, you know, what their feelings about it are, see if we are correct in thinking that their rent is about to be doubled, and you know, trying to find out what they think might be the effects of that, and perhaps asking questions at the community board, at the public hearing on Wednesday, to HPD and Bowery Residents Committee, about what the impact is going to be if, on the health of mental and physical health of the community. It's because of this project.
Well, anyway, go ahead, Cameron. I have a statement.
I guess I have 3 questions.
Yeah.
First was just clarifying, what percent of the units that they're proposing are, like, you know, for supportive housing versus each bracket of affordable housing?
Well, it's 200 units in all. One is a superintendent's unit.
Okay.
120 are supportive housing units for formerly homeless individuals.
Got it.
And it's not clear to me what the screening process is, by the way, for.
So are those all studios? Or?
Those are all studios. Every
Okay.
single one of
So
those 120.
studios?
Yes.
Okay.
There's a program where you get tax breaks for senior housing. That's 23 units.
Okay.
And then the balance of the units are so-called affordable housing open to the public, of which I think 15% are reserved for CB9.
So 15% of the remainder of those units, so that's like about.
Yeah, and by the way, I don't think that's a negotiable number. I think that's, I think the city by law, they used to be that it was 50%, I think, and they reduced it. Although, you know, if somebody wants to ask that question at HPD, that would be a really good question to ask.
Yeah, good if it was 25%.
Yeah, maybe,
And so it's-
again, I don't come with enough background.
And just so I'm clear,
Yeah.
it's 15% of the remaining, because like you said that it's 120 that are for formerly unhoused folks.
Right.
About 20 that are for seniors.
23,
That's about 140, that's about 60 left. And is it 15% of those 60?
It's
Or is it-
15, I believe it's 15% of those.
So not 15% of the overall
I know,
total.
Cameron,
I do not know.
Laquita, it's Monica. I just emailed Monique and Laquita the full breakdown.
Okay,
Okay.
all right.
And then I can-
Where
I
is
can
that from? Is
forward.
that from the the BRC site?
Yes.
Yeah, here it is. Right here.
Yeah, I heard that,
And then the second question
here it
was,
is, I'll email to the committee right now.
and do you know if, do you know what, how utilized the, the existing center was prior to this?
I honestly don't know.
Okay.
And I'm, with my background in general labor experience, I've been trying to focus on.
No apologies.
So I'm hoping, I'm hoping that this committee can help answer some of those questions.
Right.
And
And were there other service, well, the medical services clearly is important, but other things were coming out of that health center as well, like, I don't know, it was a food pantry or something,
Yeah,
but
they
there's
have-
always.
Yeah.
Chris, are you available to speak on, what you heard in reference to Emma Bowen? Chris, are you there?
At least the way that they're trying to.
I can speak limitedly. I can tell you that the Bowen Center is going to put a statement into the record for the hearing on Wednesday. I can also say that Bowen has worked with H&H and BRC to come to an agreement on their relocation as well as their return to the building. And that they did work diligently with BRC's architects to build out the space in the new building, which will house all of Bowen's programming, including the food pantry and the therapeutic preschool in the new building once they return to 1727, after the building has been completed.
Are you prepared to comment on the, rate or monthly, or the, what is it, monthly rent or?
the affordable housing component of, are you talking about?
For Emma
Chris
Bowen.
is with Emma Bowen, so. I was
Oh, is that right? Oh,
Yes.
great.
He said he couldn't restate certain things, so I was just wondering, and the other thing that David had a question about was
The
the
rent,
rent.
yeah,
What is
what kind
the
of rent
perspective?
burden, if any, is gonna be placed on Emma Bowen in their return to this new space?
I can't speak to it directly. But I can say that with the help of Manhattan Borough President, Councilmember Abreu, they pressed the administration to come up with a financial package that was favorable to Bowen in terms of being able to do two moves within the 5-year period. So moving from 1727 to West 135th and back. And then there are some subsidies for rent for both locations.
Yeah,
So
just,
they'll have some assistance as well as,
yeah, I mean, that's all very, I mean, it's nice to hear that happened, but it also does not necessarily answer the question of what the effect of this new space is gonna have on the finances of Emma Bowen. If they do have a large increase in, I think the subsidy probably had to do with the moves and the temporary relocation. I've not heard that they're being subsidized at the new location.
I guess I had a question, sort of, not necessarily for you specifically, but for the group. Just in terms of like, at these ULUP hearings, like what are our sort of like goals, expectations, like what can generally be expected? Like, if we have a hearing and then we have all these questions, do we generally expect the city to like be like, go back and then alter their proposal, or is it?
I like that question, because my thing is, I believe we've heard so much, and there been so many, it's just my in my opinion, in my humble opinion, that we've heard so much, there've been so many meetings, we've asked them questions, they come back and make suggestions. They have never taken the community's consideration. When the homeowners had a huge meeting and they were there, they are objecting to certain things, never took anything under advisement where they said, well, let's look into that, you know, and let's see what we could do. My thing is, I think we ought to state outright and be able to back up why certain aspects of things we have questions about are very important. And some things should not be questions, they should be statements. We've gone back and forth so much. And not necessarily to be hostile, but just to ask, state exactly why certain things should take place. I have a big problem with the design. I mentioned that in an email recently, but the design looks as if a person walks out and they're directly in the street. There's hardly any sidewalk. I'm not sure if that's totally legal the way that looks and for the kind of building of, you know, with service that is supposed to be represented that way. I think they need to be receptive, even if they don't like it, receptive to some other ideas in terms of how we want our community to look. Because these people who are running it, they're gonna be going home. It's the same old kind of thing. It's almost like we hear, oh, that's happening there. Okay, let's just put it up. No consideration. That's my opinion. And Dr. Milano has, and I'm
Yeah.
sorry, Dr. Milano is prepared to. Dr. Milano?
Yes, yes, I'm here. So I just wanted to clarify, so H&H was involved at the inception of this idea, and then they pulled out, is that correct? Is that what I heard?
Did they pull out? That's a good question. H&H managed the premises, starting very early on, maybe going back to the 70s, all the way up to putting this development together. They were replaced as the applicant or the lead agency by HPD, possibly because of the Euler problems. I don't know.
They were, I know something about this.
Yeah.
This was a big bone of contention. Health and hospitals claimed that for years, that the property was theirs. As it turns out, they did not own the property. The property belonged to the city of New York.
So the land, was it that the land or the building?
Both.
Oh,
Yeah, and that's why when it came up before a city council vote that I think, I think it just happened May or June. The city council member was not there, nor the borough president, but it was announced that that the community board was correct, the city owned the property, and the community had a right to have input into what was to happen at that site. That's bottom line.
Yeah.
Mm.
Go back, if I may, just to Cameron's question and think some of the stuff that you were saying, in terms of what one can reasonably expect from this public hearing. The public hearing is required by law under the city charter as part of the Euler process. And the idea is to allow the community to understand what this project is about, to ask questions, and also to provide comments and input. In terms of, and so that's all required by law. We're absolutely going to follow that requirement. As to what the effect of that is going to have, or the effect of anything we say at the public hearing. Generally, well, not generally, specifically, the community board can only make recommendations. We're part of the ULO process, but we don't have veto power, we don't have the power to force changes. The only thing we can do is make recommendations to the borough president and the city planning commission. However, which is to say, by the way, that at the end of this process, whatever we say or do, HPD is not gonna say, oh gee, that was a great idea. It is a political process. We are part of a political process that if done correctly, can, not necessarily will, but can influence how this project finally comes out. Will that happen here? Nobody can say that. But it is important for us to be there, to ask the questions that are going to really elucidate what's going on, and to make statements as a community board, as a community, about how this plan could be better, or even, we can even say, we don't want the whole thing at all.
So if we're saying it's political, which we know it is, do we have an idea where things stand now in terms of our local representatives?
You are asking the wrong person that question. I would say Barry probably has a much better sense of what's going on. Victor, I assume.
Well, I mean, at this point in time, because if we're reaching out, I
Yeah.
assume.
No,
to
there
see-
are things going on behind the scenes
Okay.
with elected officials, absolutely. And, you know, talking to Liz and Barry and Signy, I think the other importance of this hearing is to make it very loud and clear to the city that this was not the way to do business.
Right.
You know, community boards are here for a reason. You know, we are entitled to know about these projects. We are entitled to have input, have discussions at a meaningful time. That didn't happen. So that's another.
And the community board brought the broader community out so that they could have had a fantastic universal sampling of public opinion, which seemingly they did not get, even from the standpoint of environmental surveys.
Absolutely.
Or
And
asking the
let me
public.
add to that, Laquita. This is an incredibly unique site here. This is.
Yes, I'm saying.
It is
Yes.
A city-owned property. It's a pretty large piece of land. It's underdeveloped. It needs
And it
to be
needed to be
developed. Yeah,
torn down.
it needs
It's
to
in
be
bad shape,
developed.
yeah.
Absolutely. I don't think there's any question.
Right.
But if you know, this is I wouldn't say a once in a lifetime, but these things don't come
Exactly,
by.
it sits on a hill on top where you can see the water and the distance, it's a beautiful setting. That they designed to be like a prison,
Yeah.
because they didn't care the money, they just wanted to be able to do it and get the money. That's come on.
Yeah, well,
It wasn't done properly.
that's actually an interesting point, because this isn't the usual case where there is some incredibly greedy developer who's trying to milk it. The cities are, you know, legal representatives. They're people who are supposed to be doing the will of the people, and you know, to not engage properly.
I mean, to me, we're saying the city owns it, though H&H is a city, is a public hospital, which is a part of the city. So to me, that unto itself, the right handers know what the left hand is doing. There should have been proper communication among both those entities, so that it could have been rolled out properly on top of everything else you're saying. And I mean, we're meeting and we're gonna be coming out and expressing our concerns and I guess people are gonna be put on blast, you know, because what was done was not proper. But I still wasn't under the impression that it was finalized. I'm hoping that by
It's
us,
not final, it's not final.
was not final, but the fact that the city on
Mhm.
came out, that was
Mhm.
a news at the June. No, I got that, but I'm hoping that this might be an opportunity still,
I-
last ditch effort.
I think there is the real possibility of getting some things.
Okay.
Will the project turn out,
Mhm.
you know,
Yeah.
the way we suggested and reflects our vision? I mean, and again, I'm relying on the information I'm getting
And you're doing great.
from Barry and Liz
Yes.
and Cindy, because they're the ones who really have the experience. You know, they're saying we might be able to get things at the margins here that are important.
Yeah. But we gotta know it
And,
push.
and as I said before, it is really important to send a signal, because this can't happen again. This just cannot happen again.
And this come up, the fact that it can't happen again every time we've had a meeting, which I think is a good thing. It's not combative, it's a good thing. It's come up every time we've met with, BRC, who came to our board meeting back in, was it August? June? We had some special meeting with BRC. Maybe it was June. No, you're right. Maybe it was
I
June.
think Danielle had it.
Well, let me just say though,
I don't think so.
let me just say, I don't think that's a bad thing.
Right.
That it comes up. And I think it's an important point, and we gotta stick together, and I think the broader community that's gonna be there on Wednesday will make a point of that as well.
Well, I hope so. I mean, but we also have the right as community board members to speak out.
Yeah.
The way it's gonna work is there's gonna be a period where I think public officials will probably speak first for 3 minutes, then community board members can speak for 3 minutes. And then we're gonna have, the public is gonna be limited to 1 minute. But we're also collecting questions from the public, which we'll be asking.
Tonight or tomorrow?
I'm sorry?
Tonight or tomorrow they'll do it. For
The
community
public
board
hearing?
To notes, questions that Signey was gonna parse through.
You're right, there was something on
Questions,
that.
remember, we're supposed to get it,
No,
maybe it's tonight.
No.
No later tomorrow. Yeah.
I think either, well, it could even happen on Wednesday, quite frankly. I mean, you're right, there was that email, and I don't remember what Sydney said, but yeah, I'm
Dr.
sorry.
Milano?
Yeah, I was just going to say that, I read everything on the website, and I don't think they will have enough money because, and it's going to take a very long time, because when you look at all of the regulations, you will not get a certificate of need from the New York State Department of Health unless you have all of your funding in place. We needed to do a certificate of need for our move from 1727 to 1649. And it's all on pause until we have all of the money that we need to do the renovation at 1649 for the clinic that we will move into. Now, there still are Emma Bowen people working at 1727, and they're not good neighbors. Let me tell you. No, I'm not talking about Emma Bowen. We have a great relationship with them, but they still have people in that building who have not transferred over to the new their new site on 135th Street. We did not have air conditioning for the entire summer. It took them that long. It took the city that long to fix the air conditioning, and it was a very hot summer. The dental rooms were 104 degrees because they're on the top floor, and they put up scaffolding around the building for like maintenance. Nothing's going on. They just did it to annoy us. So in any case, so the city hasn't been good neighbors. They're trying to get rid of us. We're still there. We're taking care of our patients. And that's, that's all I have to say. But I really wonder if they're going to be able to, because I think that it was 4 years ago when they were saying that it would be 23, it would be, it would cost $23 million, maybe 3 years ago. And it's probably more like, closer to 30 million at this point with the increase in the price of all the things that they have to buy, the pipes and and so, so with that said, we will see whether or not this can get off the runway. That's it. Thank you very much for letting me tell you my story.
Thanks, Dr. Malone. Christopher, was that you trying to say something as well? I don't know if he's still there. I kept seeing green come to his.
And I guess my thought process around this and why I was sort of asking those questions is that I feel like, in the, like, I understand the critiques about like the process. And I think that those are valid, but I think the thing that, if I were to imagine like, the type of housing that this community deeply needs, in contrast to like the 145th Street, like, all these sort of giant towers, luxury apartments that developers are putting up, it would be stuff that is like, affordable at like, 40% AMI. It would be stuff that's like, um, that, and I think we do honestly need like I don't know about like everybody's neighborhood, but the neighborhood I live in, there's like a lot of folks who are unhoused, who are deeply in need of like, like deeply affordable housing. And I think it's like my beef, at least from the way that you described it, seems to be more with the process than the result. And I think, I think that there's issues with, I think setbacks with like street level, retail, with like, additional community space. I think all of those things are like things that I would definitely want to be in this. But I feel like the thing that I would not want to happen is to spike a project that like has, at least the way that I read it, like 100% affordable housing, because of like, my issues with the way that this came about.
I'm not gonna argue with that because I think there are, I think there are arguments on both sides.
Yeah,
And I think the core of what you're saying is correct, that there is some mix of what they're doing here that is necessary. I think there are people, and again, I haven't been on this committee long enough, but there are people who would argue that yes, we do need supportive housing for formerly homeless people, but I think there are at least 4 supportive housing developments within 4 blocks, including 2.
Oversaturated.
Yeah,
But
yeah.
here's
So
and I get that, but I think my thing is like I would rather see like the folks in my community to be like formerly homeless, like in housing, rather than like homeless, like sleeping on the sidewalks.
it's really hard.
And I think that that's, I think that there's a real, and this is something that I feel like I've felt like for a while, is that there's like a tension between like,
There's definitely
everybody wants the supportive housing to exist. Nobody wants it in our neighborhood. I think that there's definitely like a concentration of it in this neighborhood, but there's also a concentration of homelessness in this neighborhood.
Right.
And so it's like, do we want to, the folks that are, unhoused folks that are like, like they need housing. That's like the first step to like getting out of this, and it's not like a shelter.
But Karen, just to your point, the
Yeah.
people who are homeless here are not going into this. These are people who are coming out of homeless shelters around the city and being transitioned back into permanent. In fact, these are going to be rent stabilized apartments. So it's into permanent housing with supports. I think the policy issues here are really tricky because you've got only so much space and you've got to figure out where your priorities are. So I couldn't possibly argue against, your sense of priorities. But I think Barry, for example, just says that there are studies that say that supportive housing works up to a certain point of concentration, and then beyond that, it kind of falls apart in the sense that it can't be managed properly and has a negative effect on surrounding area.
But I think the issue that you guys need to deal with is the fact that it's not all supportive housing. According to what they posted, the only thing that's gonna be supportive housing are the studios.
Yeah, the formerly homeless is the only supportive housing in there.
And they use interesting language in this, and I don't wanna, like, they're referring to folks as patients. Is this like, is there some sort of medical tie-in with
These are all big questions.
But I think that was one of the things that was discussed, that a lot of the people going into the building were serviced by H&H. That was my understanding.
Cause I think it would be helpful to clarify exactly, like,
Or maybe that's a question we have to
Yeah,
ask.
I think those are great questions. I certainly don't know
cause it
the
says,
answer.
supportive housing from, so New York City H&H will identify 120 patients for supportive housing from patients eligible for consideration based on their clinical and other needs. So it's like, I'm not even sure like what that means.
That's
in
a
terms
good
of,
point.
like if this is really like,
And it
folks that
didn't
are
come up.
formerly housed, is this folks that have like a clinical need, or, and this is something that we dealt with a lot in the hospital, where there was like a lot of folks who like, had, long-term conditions
Right.
where they like needed to be discharged,
Yeah,
but
they-
because there was no affordable housing available, they were
Correct.
just languishing in the
There's
hospital.
language in the
So like,
hospital.
if that is the case, like, I'm not gonna, I'm not gonna stand in the way of like a project being built that would like.
But I would say this, once again, and as a part of one of the questions, you said only 15% of the people as it stands now, coming from CB9. It says we know the need is tremendous. Maybe, I'm wondering if there's opportunity to increase that.
And that's exactly my point.
If we're
Like,
gonna,
it's like,
if we're gonna
like,
take
I
the
don't want us to like go in this, we're like, let's vote this down, let's my thought would be to go into this with like a perspective of like, all right, what are the concessions that we can get from them? What are the things that we can extract from them? Can we extract like larger percentages of folks that are like from the community? And that's it, that is like a deep concern. Can we get,
What I would say
Yeah.
is, let's ask the right questions, right? And then, we may find, is there a limit to this 15%? Is that a regulation that you have to follow, or is
is that a
a
minimum,
negotiation?
is that a maximum? Like,
Yeah,
what are we-
right, that's right, and
Yeah.
then go from there, because we don't know a lot. And I think this question of screening, how they're screening
Yeah.
supportive housing, maybe it's, these are all people who have been certified to be employable and they have no issues whatsoever, blah, 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 blah. That's a different thing than saying, they have these needs and those needs. And so I think the first thing really is to ask the right questions.
If I remember correctly, that was a good point, Cameron, and what you're saying, asking David. I believe at the June meeting with the executive committee, all of those people were here, from VRC and from.
You're right, it was the June executive.
Yeah. And that did come up, that they would be these are people that they have
Right.
screened, and they've done this or that or
But
whatever,
screened for
coming out
what?
of their various hospitals for here. But again, the initial thing is it was just done incorrectly.
Yeah.
But I wanna just mention that, yeah, there will be probably still some anger around this project, because Dr. Katz, who runs Health and Hospitals, we tried to bring up something with him. He apparently is all in on this particular project, and it may be his baby. He was very upset that there was community opposition, but opposition for the right reasons. But still, so that, I'm just answering 2 points. So it's something that they're looking forward to, and I think it is connected to their hospitals around the city. Full disclosure, I work for HHC and Heritage and stuff.
Wow.
So anyway, I'm
And
not,
also
there's no
just brief
favorites.
Time check,
I have a
we're
question.
at like 8:10.
Yeah,
I noticed there's supportive housing also in this building.
mhm.
Will there be a preference for people within the community that need supportive
I
housing?
don't
Because I
think
can
so.
tell you, I mean, I can see that our
Yeah.
community can benefit from housing for some of our people outside, that I see constantly
Yeah.
walking up and down the
Yeah.
street.
Yeah.
It's, and keep them in community and give them the support
I
they
mean, we
need.
can ask that question, but my impression is no, that it's health and hospitals that is
It's
screening
their baby.
people from all around.
Yeah, it usually is.
Yeah,
But is there any way to press? Because I can see within this community, I see people that I see every day that can use help and not just a key,
I think these are questions we should ask.
You know what
them.
I'm saying?
Yeah.
So that's all.
Absolutely.
Okay.
All right, I don't wanna take up any.
Okay.
Any more questions from, those on the Zoom line? I'm hoping to all be or encourage others to be, just repeat where the information is. It was sent out over our email and over the, email sent from our committee, as well as, the general board from the district office. And we hope, there have been flyers distributed, but do you still wanna indicate the location of the public hearing, David?
It's a great question.
City
It's City
College.
College, it's the north,
The NAC building.
yeah,
Academics.
yeah. Let me see, I just got one of the flyers, so it's better if I look that up.
But it's on the City College campus. We really need a good turnout.
Yeah, it's City
It's a
College.
nice room.
I'm sorry, it's North Academic Center building, which is the one that faces out on Convent. It's lecture hall 1/203, which is located on the first floor. You go in the main entrance to the North Academic Building, and there'll be a guard there. We'll probably have somebody from our committee also there to direct people in the right direction. And it's just down the hall. And it'll be
If you
obvious.
need extra help with something, let me know. Maybe, we can help out.
I
Maybe
think,
we
I think
should,
we're, I
but-
think we're good. I mean, Yutha said, she's gonna have a couple people, I think there are a couple people from our committee who said they'll do some of the administrative work there. And then I shout out to Heather, thank you for coming
Shout out,
by and
Heather.
distributing flyers the other day, which,
Yeah.
that was really nice, so thank you much for that.
My contributions, emails out.
Okay, all right, well,
In terms of,
David, thank you. Go on,
Yeah.
Cameron.
in terms of like the vote, does that happen?
there's no vote. What happens is that we essentially gather all the comments
Okay.
from the community, the elected officials and from the board. And then we write a resolution. We, meaning the Housing, Land Use and Zoning, drafts a resolution, which is designed to reflect the community's feelings about this project and our own expertise.
Gotcha.
We then pass it on, I think, to the executive committee,
Mm-hmm.
who will work on it.
And H&E
And-
will probably have some input on the health side.
Okay,
They probably know.
it's not clear to me how many people are gonna have, who
And
all
I
has
think
input.
Landmark, I think you
Yeah.
guys were mentioned as one of the committees too, the other day.
We're,
Three
we're,
committees.
we're happy to spread the
So the
wealth.
recommendation is in the form of a resolution?
Yeah, and then it will be voted on at the full community board
Got it.
meeting, and then it gets passed on to City Planning Commission and also the Borough President's Office.
David, thank you for
Thank
all
you
the work
for
you have
inviting
done,
me.
and
I
thank you for
appreciate
coming
it.
here
Okay,
tonight.
well, great. Well, this was
Yeah.
fun, so.
Okay.
Okay, it wasn't fun. But it was happy to be here.
Thank
Okay.
you so
All
much.
right.
Okay,
Press the button, David.
the
Press-
button over
To your
here.
right.
Upper
Okay.
right, yeah.
Okay.
And,
Take it easy.
and in terms of people participating, I wanna thank Liz. You represented our committee let me know if you weren't able to.
Yeah,
do it.
I
Liz
went
said-
there, but it was weird because I got there what I thought was appropriate time, and you were there too.
Where?
You talking about the Riverbank State Park, right?
Yes.
Oh,
Yeah, but
yeah.
they were cleaning up. People
Right.
came-
What time did you get there?
I got there like 1 something, and they were ready. They really weren't.
They broke down, cause I went to 135th Street, I didn't know I was gonna
I
get
was
to go, but they were.
surprised because I
clearing
had the
out there,
impression they
too.
were going until like 3 or 4, and I was there to spend the
Yeah,
afternoon working with them.
Yeah.
But that's okay, next time.
But you went, and I think that's commendable, cause each of us can't make everything.
No, I didn't
And
mind. I was
so-
looking forward to it.
Yeah.
And I'm like, what are we doing? And then I saw you come up. And we
Yeah.
were both looking for,
Yeah,
but
we were
apparently they
hot.
closed early or we got the date. I could have sworn the flyer said till 4. I really did.
It did, and I
And
got
so
there.
I figured I got 3 hours, but then 1:30.
It was the Emma Bowen, health
They
fair,
were wrapping up.
Yeah, they were.
yeah.
Yeah,
So,
but
but at least
We
you,
were there and we made the effort.
and
And then
I
our
wanna
final-
now correct and say thanks to Liz
Yeah,
Eastman
yeah.
and to Monique Hardin Cordero.
And I
For
would do
showing
another
up
one. I have
to
no
represent
problem.
us.
Well, I'm glad that
I was disappointed.
Walter was there, apparently, Yutha, I'm not sure who else from the office was tabling, but yeah, it was a great day and there were a lot of people out there, so I believe a lot.
Did you run out of
I
materials,
believe
Chris?
that they had a lot of,
You may not be on the line.
participation from the community. It was a beautiful
Maybe
day.
they just ran out,
I
which is
don't know
really,
what happened, but
Yeah, okay, I mean, I
probably
was
ran
like,
out of materials and stuff.
maybe.
Yes,
I mean,
I was there before, you figured it closed very early. But anyway,
Oh,
I didn't mind.
Chris just unmuted.
yeah, Chris?
No, we had enough material. But we had great crowds, and it was a good experience, and I think we're gonna try and do it there again next year.
Yeah.
It was really nice having the big space and layout. Everyone seemed to really enjoy themselves. And the community partners were happy with the turnout and the enthusiasm in terms of, what we do to try and make it beneficial to both the attendees and the community partners is when individuals show up to the event, we give them a passport book and we give them incentive to visit with all of the participants, partake in the health screenings, and earn the opportunity to go home with free giveaways, as well as earn raffle tickets. So we truly try to make it an event that's beneficial to both the attendee and the community partners.
So Chris, let me ask you, so the reception table broke down, but other activities were still going on?
Yes.
Okay, so there was no.
But there was a lot of stuff. So, this is a fun
Yeah,
day.
and people were going back and forth between the two sites because we did everything was primarily at Riverbank, but we also had health screenings over at 135th Street.
Okay.
And we provided a free shuttle bus that took people back and forth.
All right. Well, I did go. They had broken out everything, so. All right, so any other new business?
Yes. Yes. Hi, Laquita.
Yes, ma'am.
The last day to register for new NYC Cares is November 1st. We need to get that information out. That's for people who are not eligible for Medicaid or Medicare.
Was that middle part of,
Yes. And so the community needs to know about it and we need to get that message out.
yeah, I'll find it from youth, I believe, and I'll find out, I don't know if Ashley's still here.
She is.
Okay, I think you guys put it on the website. I just took it out and put it as part of our, um, information or outreach to the, I think it's 70 on my list, maybe 60. So, if we all take that middle section that just what Monica's referring to, New York City NYC Cares, in terms of people who need, extra services who, you know, especially with the, government, shut down and all, just make sure they get it and know where they can go for help. Thanks, Monica, for that reminder.
No problem.
Thank you so much. So everybody who has some kind of.
Laquita, I just wanted to add one more thing.
Yes, Chris.
Just wanted to remind everybody that the Bowen Center's food pantry is opening up its to government workers that have been furloughed due to the government shutdown. So if you know of any furloughed workers who are in need, please spread the word and let them know that the center's pantry will accept them, and they're going to be adding an extra day. The pantry is usually open Tuesday through Thursdays from 11 to 2. Beginning this Friday through the shutdown, they're going to add Fridays from the same time. So it'll be Tuesday through Friday from 11 to 2
What location, Chris?
at 1727. So the Bone Center is still at 1727. They should be moving to 135th Street sometime fully before Thanksgiving. That building is now going through final approvals with Department of Buildings and with the city and state agencies. And then as soon as that's done, the move there will take place. But for right now, Bowen is still at 1727.
Do you have a flyer related to the shutdown, the pantry, food pantry?
Yeah, I can email it to you.
Okay. Now make sure everybody else gets it so they can email it. If you send it tonight, I'll email everybody tonight.
Okay.
I just, Monica, I emailed, well, you just, I emailed everybody, on the Hilltop, part, the, Bowery. Okay. I want to thank Cameron for coming to the ready with his use of his laptop, you know, so that we can have some consistent, you know, sound at least from, our Zoom experience. So, seems like it's okay. Has it, you know, it did go off several times, but thank you guys for hanging in there with us. And thanks Cameron again. And it's recording.
It is.
Can you, it's not recorded on yours, Cameron?
It's recorded everywhere. It's gonna go to the
Okay,
cloud.
so can I get an AI of that? Cause I gotta fix the other minutes. And I could do this one too, so at least it'll be ready for executive committee next week.
This week.
Oh God, is it this week?
Yep, it's this week.
Thursday?
Yep.
Thursday.
All right, y'all. Could we get are we good?
So, I have a question. So, even though Barry didn't come regarding the district
Yeah,
news statement, I'm sure there was, a reason. Don't we need to, have a discussion in terms of,
Let's schedule it. Please read the district needs statement. Can we schedule it for November? Cause that's really critical.
yeah, we want to give people time to look at it and weigh in.
Yeah, so now you have, it's already emailed to you.
The report, yeah.
And it's
in
for
our
every
section.
committee you're on, you really should look at, you know.
But then we're
I
having a
think we're the first
discussion.
one to have the discussion.
But we have meeting
We
to
have
have that
It's due.
discussion.
That's why I asked if we could put it on November's agenda.
No, but doesn't Youth want us to, we're having a public
Oh my goodness,
hearing
there's
this
a hearing
month,
on
I
that
think,
too.
right, Ashley?
On what?
The district needs
Right, thank you,
budget?
Heather.
District needs statement.
Right, the district needs, isn't there a public hearing
I
scheduled
believe so.
for October?
Yeah, it's definitely like before October 31st.
Oh, okay.
All right, so maybe
Sounds
we could
very-
do something by Zoom.
We can certainly try to do that.
Can
and
our
just go
committee
over-
do something by Zoom?
to go- yeah, to go
Before, what date is it? Actually, October,
1 second. I have to-
okay.
And do we,
Lena?
what is the product that we need to come out with? Do we need to come out with a
We
committee?
sometimes make, a lot of times make additional suggestions to add money to certain city
Areas that are-
agencies to
Okay.
cover aspects of a program that falls.
And do
in
we
health
generally
and
suggest
environment.
as a committee or do we
We
suggest
could do
individually?
it individually and then we put it together, as a packet,
Yeah, but,
coming from health and environment.
well, we can start by looking at what was submitted last year and have an idea of what was approved and what couldn't be approved and.
Yeah,
You
does
know.
anybody have that? I don't have that.
Yeah, it's in the district needs statement. What you
From
have
last
is
year's?
what was,
Okay.
that part that was, suggested from last year.
Yeah, it was sent.
And,
Cool. All right,
Just
we
do a
have people
search on
dropping off.
district.
I
Can
know I
we-
dropped
I'm not
in,
sure.
but not on the committee.
I think
It's just
September
for the
10th
committee.
was sent.
Okay.
The
I'll take a look.
And I'm gonna have to get back to you on that date.
Okay.
All right,
Okay.
just,
So Lena, is there any particular date if we, just real quick, everybody, if we do a Zoom committee meeting, can it be on like a Tuesday?
What day?
Oh, well, you know what, is Monday, October the,
I could
13th.
do next Monday.
Yeah, that's a holiday, right?
is that a holiday?
I think that's Columbus Day.
It's Columbus.
Indigenous
/
Peoples Day.
Indigenous
I like indigenous.
Yeah.
Right.
Well, is anyone doing anything that evening? The 13th. Be very frank, I know I'll probably be coming from work and I'll be okay, but I'll celebrate it in my indigenous people in my own way.
Yeah, is there any way we could just put it, try to do it by email, right? Or in a document where it's online, like a Google Doc, and then we can all kind of edit? Is that possible?
Could I start like a Google Doc and then folks like add their suggestions in?
That's a good idea too, but some people may wanna talk it out.
Some
and
people
then-
might.
Yeah,
I don't-
but do that, Cameron. But
I'll-
it's true,
I'll
no,
s-
that's excellent.
All right,
That's a start.
Then we
I'll
do
take a
both.
look at last year's and see if I can create a little
Maybe
format for
we could
people
do
to drop
both
in.
in terms
And
of.
if we're unable to resolve it via Google Docs, then maybe we can find a meeting time. Does that
But
work?
some people are new and then they need to hear and
Yeah.
how we look at the budget is interesting in terms of our statistics and all that. That's why Barry's good. But
Yeah.
anyhow, so is Monday or Tuesday next week good for anybody? I can do either.
On Monday, I
Okay.
can do in the evening.
Okay, that's the 13th. I'm good. I always have something. I just make the time, so.
I'm trying to actually.
Yeah, so I can do either day. I'll make the time either day.
All right.
What about you, Lena? For Zoom?
The Tuesday is the other committee I'm on, something youth education libraries. So that's that same night.
Which,
Tuesday night, next Tuesday is the youth education libraries committee. Can you hear me?
Right.
So
Oh,
now
I can hear you,
I
Lynn.
can hear you.
Okay.
Yeah.
I could do Monday if necessary, but I have all day meetings that day, so it's not ideal. So I would love to try maybe to do the the Google Doc thing and then see where we are. But if people need to meet, I can try to join
So let's say
on Monday.
everybody will get the notice, me, Monique.
Let's see, maybe we can try to
Liz.
like put the feedback into the Google Doc by Monday and then we'll look at it and see like, all right, do we need to meet or is this like fine?
Well, let's just get it out of the way. Cause let me tell you,
I don't-
scheduling meetings is back and forth. It can be,
Okay,
you've
let's,
done it, I know, but it's still, I'd rather.
What we really need are the responses from the agencies, that's different from the district needs statement.
So if we, like,
Okay.
we have to contact these, agencies too, or find out who's who.
Yeah, I guess to find
I
out.
have not seen the responses sent out by the district office yet.
You said we have
I
not?
have not. I see the district needs statement, that's different from the actual agency responses.
Did Ashley
thought
said
that
she
what?
couldn't find it?
She was looking, let me see.
yeah, she hasn't found it. She
Let me
doesn't-
see if I can find
It
it.
was sent.
Like the hearing date?
No, in a public hearing
All
for
right.
the budget.
Do we wanna
Well-
adjourn real quick, or are we
Oh,
still trying to hash it out?
Well, it's 8:30,
'Cause
but
I think
we
we're-
got a couple of minutes, because we did meet our 2 hour, except for it was important with the district meetings. What about the October 20th? That's Monday, October 20th. That gives us a chance to read, get the feedback, Monday, October 20th.
If necessary, yes, if
But
necessary.
still, and if you
We can-
can't, but
we-
there's some people who need
Let's put a hold on it. Can we put a hold on October 20th
until we know.
and then see if we can get it done before then?
Yeah, but I'm trying
And
to.
we have conflict of interest training from 5 to 6. So we'll have to-
Oh, on the 20th? Oh, God, we all need to do that. We're supposed to do that.
That's
Shoot.
mandatory.
Thank you. You know what, let's just try to do what we can by the 13th, and then whatever's unanswered, or we need questions, just put it as a remark, remarks side, the
Yeah,
comments section.
I think
So
we got it.
when you gonna start the Google?
I'll start it when I get home.
Okay.
Yeah, I'll,
Keep the language as it currently is, and then we just add in, because some of we may not have to change.
okay.
That was
Yeah,
approved.
just, if you just resend the document, just so I know that I'm
Which
looking
one
at the
is
right
which?
one,
I'll do it right now.
and then I'll start when I get home.
And you wanna see a hard copy as well?
Do you have it
This
on
is
you?
a hard copy.
Okay.
And I can send you, cause it was in this notice, you got this notice, right?
Yeah, I think I was just trying to figure out like what our comments were supposed to look like.
It's all blended in there so that you might not see it
So it's not like a separate. Okay.
But our needs, some of the needs I see, even in terms of, I have a different perspective on what we need. Radiology
Yeah.
place, endocrinology, anyway, we're gonna leave. Motion to adjourn?
Oh, I motion that we adjourn at 8:32.
Second.
Second. Okay, thank you so much.
Thank you, everyone. Have a good night.
On your trip that you're on?
Oh, yeah. I'm in Montreal.
But anyhow.
All right,
Whatever
take care,
you're
y'all.
doing.
Thank you. Bye.